Okay, this is the May 20th weekly session of the Legislature COVID-19 briefing. And I am beginning recording now as well. Mr. Chairman, the meeting is yours.
And I'm going to throw it right back to you and say, what for an agenda? Do we have a health department here?
Okay, this is the...
Yes, I'm here, Mr. Chairman. This is Deb Miner.
Oh, thank you, ma'am. You want to kick it off, Deb?
Sure. So the numbers for today, we had one new positive case reported to us. So that brings us to a total of 13 positive. Of those 13, 11 have recovered. We have currently no one hospitalized. We have 40 individuals that are under an isolation or quarantine. Thankfully, we've had no deaths. And we have tested or received negative test results on 1,023 test results. So that is 13 positive out of 1,036. So we have a very low percentage rate of people testing positive in our community. The testing of nursing home and adult care facility staff has begun, and that is being conducted twice a week by either the adult care facility or the nursing home in conjunction with the hospital. And the hospital continues to operate their drive-through testing site on Monday and Wednesday mornings, Friday afternoon, and then on Saturday, they are operating the drive-through testing site for individuals who are having elective surgery because folks having an elective procedure have to be tested, but there's a particular window of time that they have to be tested in. I believe it's 96 hours prior to their procedure. We continue to respond to the complaints that are directed to us or the concerns that people post on social media about social distancing, wearing of face masks, outdoor seating, those types of issues. I've been to a few of the establishments in the village, as have some of my staff, and spoke with their managers or owners. We've spoken to some folks by way of phone. Yesterday, I did go in person with our county administrator and our sheriff to Walmart. We did speak with two of their assistant managers because many of the complaints that we continue to receive are regarding customers in Walmart that are not wearing face masks, and some of the responses that people have gotten when they brought it to the attention of management there. I did work with Mr. O'Hearn and Mr. Gutman in drafting a directive to Walmart requesting their compliance with enforcement of their customers wearing a face mask, being able to offer them a face mask if they present without one. And that was delivered to them late yesterday afternoon.
Very good. We have questions for Deb, anyone?
I can add a follow-up to that. We did receive word. I received a phone call from the store manager this morning from Walmart. They intend to fully comply with the directive. They have hired or are in the process of hiring a third-party security firm to screen individuals as they enter the store, and people who are not wearing a mask will not be allowed in the facility. We have also supplied them with masks to provide customers that shouldn't have one. So that's the status. I want to emphasize that Walmart was very cooperative in the whole venture and complied as close to immediately as they could.
Absolutely. The other entity that we continue to receive complaints on tends to be the state park. So I do anticipate we'll probably continue to get more of those with the nice weather. A lot of this just rests on personal responsibility. The folks that are going to the park and walking to the park. I believe that the folks at the park are trying to limit how many folks are coming in. They're blocking off some of the parking spots. They were going to make the trails one way, but still people will get around some of that. If there's no available parking spot there, they'll find a different place to park in the village and just walk. So some of it does come down to personal responsibility.
Tim, this is Michael, I have a question for you. Is there a reason that Walmart didn't supply the masks themselves? Are they not able to get them?
Actually, we offered to supply them if they don't have them. They didn't indicate that they would necessarily be needing them from us. We did drop off through Bill Kennedy 1,000 a couple of weeks ago, but they didn't indicate that they had any difficulty procuring them themselves either. So.
Anything else for Deb?
No.
Is your staff all holding up pretty well, Deb?
I believe so. I think we have COVID fatigue, like probably everybody else in the community. But one thing that the staff has done to help to support each other and to assure that we can have some social distancing in our office space, because they're all working in cubicles, and if everybody's there, it's a little difficult to stay spaced out, is that they came up with their own plan on how they would rotate so that everybody gets a chance to work remotely, because you know, it's a different perspective if you're working remotely from home and you're maybe not having to be interrupted by other things that you are in the office. So they've determined a schedule that seems to be working very well. They're very supportive of each other and making sure that no one is taking the brunt of all of the work, especially on the weekends, rather than taking an entire week and weekend of being on call. They made the decision that they would like to just do one day at a time. And that seems to be working out very well. Again, it just spreads that workload out over the professional staff. And no one feels like they've got the entire weekend that they are responsible for.
It's good. Very good. Other questions? Tim, is Bill Kennedy here?
Yes, Bill is on.
Bill, you're up. Thank you very much, Deb. Good job.
Well, good afternoon. First thing, I'd follow up on some of the complaints we received. They've been, the ones that go through the state have been funneled to my office, at which time they'll go through dispatch and a regular complaint is put in our system, and we're dispatching the law enforcement of the agency, whether it's the village or the sheriff, to go follow up, or state park police if it's a park. Some of the issues we've been having where people don't see things followed up right away is when they've come from the state, they've been anywhere from 15 minutes after the complaint to 10 days after the complaint that we actually received it. So a lot of the times we'll receive the complaint 2 or 3 days later. To be able to follow up on it has been difficult, but they have dispatched an officer to every complaint that we've received. Beyond that, for our most part, what we've been working on is working with the hospital and the Falls Home on getting their testing supplies. This week they started receiving them directly. And I know within the last week, the hospital has received somewhere around 1,300 test kits, with another 200 and some going to the Falls Home. So that's the biggest thing we've been working on. As far as getting masks out, we did supply some to Walmart and Tops early on a few weeks ago. Last week to Chamber of Commerce, we delivered 5,000 to them. so that they'd have them to give to businesses. So at this time, we're up over 12,000 masks that we've distributed out of the office that was given to us for other agencies to distribute. OFA had a supply of them. Mental health was requiring to have a certain supply. So we've have over 12,000 out there in the system around the county that are available if they're not already out there. The state park got 500. So there shouldn't be any reason for people not to have masks. That's really about it from my end.
Is Deb, are you still online?
Yes, I'm still here.
Oh, just what is the rule, so we all hear it together, for wearing masks?
So for the general public, they are asked to wear a mask whenever they are out in public and cannot assure that they are able to social distance, so to stay 6 feet from another person. The requirement is a little different for businesses and retail establishments, employers, and very different for hospital, healthcare, nursing homes. So for the reopening of businesses, retail, they are required to supply masks to all of their employees, and their employees need to wear them. So it's not just a matter of, I'm in a office or a business where I don't have any contact with the public. They still need to be supplying their employees with masks and having their employees wear the mask when they can't stay 6 feet away from even their coworkers. I think when we talk about, for example, a store, I'm not sure how anybody can assure themselves that if they walk into that store, that they're going to be able to maintain 6 feet of distance from all other customers and the staff that work there. I mean, unless you're going at a very odd hour of the day where there's very few people there, I just don't know how you can assure that you're going to stay 6 feet away from everyone. So that's why it's important for the customers going into a business like Walmart to wear their face mask, even though they're trying to stay 6 feet away from other individuals.
And actually, under the rules that went into effect in phase one, all businesses are required to, businesses that have indoor operations, this outdoor is a different animal, but are required to make their customers wear masks. And they're not required to supply them, but they are required to make their customers wear masks on any indoor business. So that is something that is, well, that's what's actually changed this whole enforcement issue in the last week. Additionally, all businesses that were open prior to phase one that were deemed essential businesses are subject to the same rules of anybody going into any of the phases. So essentially, any business that's open needs to comply with all of the rules that are set forth for, at this point, phase one businesses, but they'll be expanded as the scope goes on. And these are not our rules, and we make sure that we are clear to from every county that we are carrying these out as part of the states in the governor's executive order. This is not a Schuyler County legislative directive; it's a New York State governor's directive. So that's where we're at on the enforcement and the rules themselves.
And if I could just add, Chairman, I think probably the best thing for folks to do, if they have a business, if they have a restaurant, a retail establishment, etc., is to go to the state site and review all of that information for themselves that is specific to their entity type. rather than relying on myself to be able to provide that to them. I think they really do need to review it themselves.
Okay. Any questions around that? Bill, were you finished or did you have more for us?
No, I was done unless there's any questions.
Okay. Good job. Thank you. Thanks, Deb, for all the information. That's great. Tim, what else we got?
Just a couple of things. I did provide you with two documents yesterday. One, a comparison of the competing federal proposals for the next round of stimulus. It's fairly self-explanatory. I think the main takeaway is that this is not going to be an immediate action. It will be June at the earliest before this is taken up, and we really don't have any definitive guidance as to what will ultimately be adopted or if anything will be adopted, although the school of thought at the federal level is that something is going to happen that will provide assistance to states and local governments. What that particularly is or specifically is remains subject to the political and negotiation process. So that's just for your reference, so you're aware of what what's being proposed. The other document I sent was it's a draft, but it's probably very close to a final form of the county's reopening plan. And just to carry on from the discussion that we began last week, the Administrative Council continues to meet weekly and discuss not only the general guidelines, but departmental specific. What my recommendation is that we tie the county opening, which will probably be phased and will certainly be phased with respect to how we operate. But we tie that to the opening of DMVs. At this point, I think you're aware that DMVs remain closed by executive order, and as such are not able to open at this time as part of phase 2, when we would have thought they would fall into as a professional service. There is speculation and optimism that the governor will, similar to what he did with the hair care and salons, modify or rescind that order prior to the 7th of June or 6th of June when it is set to expire naturally. So our guess is somewhere between June 1st and June 7th, DMVs will open back up to the public. And at that point, my recommendation again is that we start opening our offices to the public. That doesn't mean that we're going to necessarily wait until then for all staff to return. I've also, independent of that, asked department heads to submit their department specific requests for staff to return to work and a justification as to why it's necessary at whatever point. And I'm dealing with that, case by case. But as an example, highway will be returning June 1st. And some probation staff will be returning June 1st in advance to prepare for when we open to the public. The district attorney, I'm just going from memory here, his furloughed person would be coming back on the 15th of June. So there will be, some staggering based on the need and, the organization's needs as opposed to the employees' needs, I guess. But so that's where we're at this point in time. I don't know if you have any questions concerning the reopening plan. We're trying to keep it very general, and I'll also understand that probably similar to what happened with the businesses, the state will come out with specific guidance that will override what we're doing anyway. So if we were to open tomorrow and use our plan, we could do it. There are very good odds that we'll be getting a new plan from the state anyways, but so that's where we're at this point. Stephen, Stacy, Deb, and Bill have all been involved in this process in one fashion or another, and I certainly feel free to chime in, any of you that if I'm missing anything here.
Okay.
I just have a
Question?
question
Go
about the DMV, because somebody called and nobody picked up the phone, but if they leave a message, they'll get a call back.
That's correct. We block out a couple hours every day to return phone calls, and I found early on that somebody would just need to be answering the phone all the time. So they process what comes in the mail, then return phone calls at some point in the day. So what I've been telling people is not to get discouraged. If you get a message, we will return your call. So, and we do have 2 staff people working. We have 1 staff person there every day and 2 staff people there 3 days a week. So,
Thanks.
Other questions?
Tim? Yeah, I've got one. It's a van. If during the pendency of this, has anyone, any potential victim that was tested and thought they may have it, was anyone referred to a care facility or home like the flap down in New York City that's developing?
no, actually the majority, and Deb chime in here, but the majority of our cases have been asymptomatic. They're largely healthy individuals.
Yeah.
We still have not had any hospitalizations and no deaths. So,
Okay, yeah.
Yeah, I would say that our recent cases have all but, I believe the one that we just got today has had some cough type symptoms. But most of the recent ones have been asymptomatic, and the ones early on did have symptoms of fever and cough, flu-like symptoms, but everyone has been isolated or quarantined in their own home. We have not
Okay.
put people
Good.
anyplace else.
Good, thanks.
and that also reminded me, I meant to mention, speaking of the numbers, Deb outlined ours, but we, as you're aware, we have daily calls with the control room for the region. The region's numbers are improving. Our numbers are better today than they were last Friday when we started, as a region. So we, at this point in time, have no reason to think that we won't easily proceed to phase 2 in the recovery plan.
Okay.
Tim, I got a question for you. People that I've talked to are concerned, of course, about the impact on our county budget, but along with that is on schools. I haven't heard much about school aid or reimbursement. Is that part of the federal stimulus? Does that come under local government, or is that entirely a different reimbursement through the state?
That will be through the state, and I think the schools will be okay if the state doesn't cut their aid. If the state receives the federal money, they won't theoretically have a reason to reduce school aid, but the schools haven't incurred any dramatic expenses as a result of COVID. They've had feeding is the main one, but nothing that wasn't budgeted anyway. So, and the schools, as you're aware, aren't dependent on sales tax. Their revenues are state, federal, and property tax. So in the grand scheme of things, the government that's most at risk here is county government. The towns and villages really have had minimal impact from this as well. They probably, assume they're to be factored into the distribution equation at some point, if it in fact happens. Their losses have been minimal, especially since sales tax distribution is capped. So by and far, the impact will be felt the hardest at the county level, all across the state. But ours, I think, is going to even be disproportionate, certainly to the disease, because of our dependency on tourism and we knowing that we're not going to have any large events this year. So we're planning on taking a pretty big hit this year, and hoping that we can get back to normal in some sense anyways next year.
Thanks.
Sure.
This is David Reed. I have a quick question for Deb. when people are tested and they come back negative, everything's okay. But all these people that are tested, does it also say whether or not this test, does it say that they had the COVID virus before and have already recovered? Or does it just say, are they active at that time?
So the test that is being done, the diagnostic test, so any of the positives that we're reporting, that's a diagnostic test. It looks for the virus. So the results of that test mean that the individual is currently infected and is shedding the virus. It does not tell us that they have immunity. The antibody test is what looks for antibodies or immunity, but what we don't know is how long that immunity lasts for, or is there even any immunity at all. So just because someone has antibodies, does that mean that they, if they're exposed, are not going to get reinfected? The diagnostic test that shows that you have the virus is a point in time only. So people need to keep that in mind, that, you know, if they get tested on Monday, it means they were negative on Monday. It doesn't mean that they were negative on later in the week. Does that answer your question?
Yeah, so basically, every one of us could have already had this with very mild symptoms, already recovered, and it will not show up on a test that's being given. Correct?
It would likely, well, it would show up on the antibody test, but the antibody test is not what is being offered in most instances. The state health department and the governor's office have done some randomized and targeted testing with antibodies. So for example, if you, I believe it was yesterday's press conference, the governor was talking about the number of individuals living in certain areas in New York City, and there was a high prevalence of positive antibody testing. Whereas, you know, he said, we thought we would have seen that with the healthcare workers who are faced with caring for these sick individuals every day, or the bus drivers and transit workers who are transporting people. Instead, we are seeing it in these other pockets of people. So that is showing previous infection. But by and large, it's difficult to find a place to get that antibody test.
Okay.
All right, good.
Deb, do you have any, Mark Rondinaro, and my apologies, everybody, for joining late. It just blew off. Deb, do you have any information if they are planning to ramp up antibody testing, or what the future plan is?
I think that at this point, what the governor's office and the state health department are doing is they're using the antibody testing to get a sense of what might the prevalence of this virus be. But until we know what that test result actually tells us, is someone immune? Are they immune for 6 months? Are they immune for 3 years? I don't envision that it's going to be something that is offered to the general public at this point. It is not something that we can use. So for example, with our healthcare workers who have to be tested twice a week, even if they have had a positive test in the past for virus, they still have to be tested twice a week. Even if they have a positive antibody test, they still have to be tested twice a week.
No, I understand it. My thing is more to whether they were actually looking at it much more broadly to be able to gauge how much of the state, rather than just New York City, has.
Well, they did do some testing, but I think for us, the closest was in Broome County and Monroe County.
That's
They
right.
went to some grocery stores and did unannounced drive-through sampling.
Yep.
There's not been any further discussion that I've been a party to about that being planned for in the future.
Okay. And the last question is were you on the call? I believe it was 2 days ago when NISAC did the webinar about testing basically water samples from wastewater for tracking RNA for this.
I was not on that call, no.
Okay, well, it's something that is being done at Syracuse University, and they're looking to roll it out. They would like to be able to roll it out broadly in the state, and it seemed very interesting to me, so I will forward you that info, and possibly Jim, I think it might be something very much up your alley as well, if you were not on that call.
I was
Thank
not
you.
on the call.
I would appreciate seeing that.
It was very fascinating, and I'm also taking it to the Seneca Lake Wine Trail, that it may be worthwhile if they might be interested in being involved in or at least pushing it on the political side, that if we could test, say, maybe 4 or 5 make 4 or 5 good-sized wineries a part of this around the lake from their septic systems, that might give some real information about how much loading is coming into the area on the tourist side.
Okay, good.
Hey, Mark.
Anything else, Mark?
Mark,
No.
could you copy me on that?
Okay,
And-
yeah.
Thanks.
Well, let's move to Stacy. You got some key dates for us, Stacy?
Just gonna hold all the committee meetings again on Wednesday, June 3rd at 9 o'clock. The agendas are done and posted on the webpage. Legislative Resolution Review Committee agenda will be posted most likely Monday. And Tuesday, sorry, Monday's a holiday.
Anything else?
That's all I have.
Jim?
No, I have nothing else to offer unless you have questions for me.
Anything for the good of the order?
Yeah, I got one more, and this is for Tim and for the county attorney, if you're on the call, Steve. But did you guys see that there has been a release of the DiPietro and oh crap, what is her name? The New York State Senator, the bill to rescind the governor's emergency powers. So was wondering if Steve might be willing to look, because he's so good at writing these things, draft a resolution to come to LRR for CDNR to support those bills.
I'll be happy to take a look at them and write something up for consideration by the legislature.
Very good. Do you have those numbers, or do you want me to send them to you?
Why don't you send them to me? I'm pretty sure I have them, but just to make sure we're talking about the same bills.
Okay, good enough. Thank you, sir.
Thank you.
Stephen, I skipped over you. Anything for the group?
No, I think Tim and Deb covered the current public health issues with Walmart. And as far as the opening goes, we're still monitoring what the courts are doing, because obviously what the courts do affects my office and a number of the other agencies.
Good. Very good. Thanks a lot.
Thank you.
Tim, thank you for your help. Deb, Bill, Stacy, we all appreciate it. And we'll
Thank you.
talk to you next week.
All right, have a good holiday, everybody.
Enjoy the weekend.
You too.
Nice weekend.
Enjoy it.
Have a great week.